Hello and welcome to Group 66 presentation of the upper and lower limb. Let's begin by comparing and contrasting the large bones in the limbs, the humerus and femur. When we look at the humerus and the femur, there are obvious similarities and differences. They are both classified as long bones. Both the humerus and the femur have a head at the proximal end that attach the bone to the axial skeleton, and they both have medial and lateral epicondyles at their distal end. The major difference here is that the femur allows us locomotion. It is the more weight-carrying bone of the two. This allows the humerus to acquire increased mobility as well as increased manipulative skill. Moving on to the lower parts of the limbs, we have the radius and the ulna in the lower arm, the tibia and the fibula in the lower leg. The most striking similarity is that they are parallel to each other. The ulna is parallel to the radius and the fibula is parallel to the tibia. In terms of functionality, both bones allow muscles to be attached that allows movement of the arms and legs. One additional characteristic of the forearm is the fact that the radius pivots around the ulna to allow us to rotate our forearm and wrist. Next, we'll discuss the joints of the upper and lower limbs. Beginning with the glenohumeral joint and the hip joint, both joints are multi-axial synovial ball and socket joints. The glenohumeral joint, however, has the greatest range of motion in the body. However, it also tends to be the most unstable. The strength here comes from the rotary cuff muscles around the shoulder joint rather than the actual ligaments. The hip joint is stronger and more stable. It actually needs to support our body weight. The elbow and knee joint are actually made up of two separate joint articulations, the humeroulnar joint and the humeroradial joint in the elbow, and the patellofemoral and the tibiofemoral in the knee. The elbow is more stable, though less mobile, while the knee is the stronger of the two and the more complex. It has collateral ligaments, it has fibrocartilage pads, as well as cruciate ligaments. Major difference between the radioulnar and the tibiofibular joint is that the former is a pivot joint, whereas the latter is a plane joint at the proximal end and a fibrous joint at the distal end. The obvious similarity is that there's an interosseous membrane between both bones in both cases. In the radiocarpal joint, we have a synovial condylar joint. It is stabilized by an articular capsule with very broad ligaments. The ankle joint is a hinge joint that is very highly modified. It has various lateral and medial ligaments to secure the foot to the tibia and the fibula. The intercarpal, intertarsal, carpometacarpal, and tarsometatarsal all contain synovial plane joints. The metacarpophalangeal and the metatarsophalangeal contain condylar joints between them and the phalanges. The interphalangeal joints of the hand and of the foot have a lot more similarities. They're both synovial hinge joints, and they both allow flexion and extension of the phalanges. We will now look at the pectoral girdle and the pelvic girdle. The obvious difference between the shoulder and the hip is that the anterior muscles at the hip are longer and more lateral than those at the shoulder. The deep anterior muscles of the pelvis are strong, vast adduction muscles, whereas the pectoral girdle has several smaller and more numerous muscles, and that offers a wider range of motion. Posteriorly, both the upper and lower limbs have large, powerful muscles. A major difference is that the muscles of the upper body cover a greater lateral area than those of the lower body. The deep posterior muscles of the pectoral girdle contribute to a full range of movement at the shoulder. The deep posterior muscles of the pelvic girdle only control medial and lateral rotation. Anteriorly, the similarity between the upper arm and the thigh is that they both contain muscles with more than one head. The difference is that the arm has a bicep, the thigh has a quadricep. The quadricep is larger because, of course, more power is needed in the leg. Posteriorly, the triceps and the hamstrings are similar in functionality. However, the hamstring is larger than the triceps, and the hamstring is part of a group of muscles that flex the leg, because again, more power is needed in the leg. Next, we'll compare muscles of the elbow and the forearm versus muscles in the knee and the lower leg. The biceps, triceps, brachialis, and brachioradialis are responsible for flexing and extending the forearm. Anteriorly, the forearm contains pronators and flexors to flex the wrist and the hand, as well as tendons to move the phalanges of the hand. Posteriorly, the forearm contains extensors, which extend the wrist and the hand. The lower limb contains the most powerful muscles in the body, the quadriceps femoris, which also come together to form the patellar tendon. The lower leg contains anterior tendons that extend the foot and toes, as well as lateral muscles that help stabilize the foot. Posteriorly, the superficial muscles help flex the leg and the foot. Besides flexing the foot, the deep muscles also flex the toes. Here is where we will find the Achilles tendon, which attaches the gastrocnemius and the soleus muscles to the calcaneal tuberosity. To sum up, the upper arm muscles are smaller than thigh muscles. Flexors are located in the anterior of the arm, whereas flexors are located in the posterior of the leg. The lower leg muscles are stronger because they need to support body weight. Both the forearm muscles and the lower leg muscles have optional muscles. Movements with synovial joints and various muscles. We have flexion and extension in the wrist and elbow joint using triceps and biceps. We have abduction and adduction with lateral movements of the deltoids. We have elevation, depression, protraction, retraction of the jaw, pronation, supination of the forearm and wrist, inversion and eversion of the foot. We have dorsiflexion and plantar flexion of the foot, as well as flexion and extension, adduction and abduction of the legs. The two questions we would like to pose our audience are: question 1. We read about plantar fasciitis, a state that is mostly caused by overexertion from weight-bearing activities and age. Is there a possibility of a similar disease occurring in the upper limbs? Question 2. We've categorized and compared the lower and upper body muscles. However, can muscles from the lower body affect muscles located in the upper body? If so, how? We would like to take this opportunity to thank you for listening. Citations